Antipsychotics are prescription medications used to treat the frightening and sometimes debilitating symptoms of psychosis, like hearing or seeing things that other people don't, or feeling afraid and in danger with thoughts that people are trying to hurt you. They work by affecting neurotransmitters in the brain. Neurotransmitters are chemical messengers that help cells talk to one another. Dopamine is a neurotransmitter that is thought to cause psychosis when there's too much of it, and the medications work by blocking the dopamine receptors. Think of psychosis like a house party full of people that has gotten out of control, and the people represent too much dopamine. The antipsychotics work like putting a bouncer at the door who controls how many people can go in, so the party stays more calm and quiet. There are two categories of antipsychotics: first generation or typical antipsychotics, and second generation or atypical antipsychotics. The first generation antipsychotics block more dopamine, like the bouncer only letting a couple people into the party. They're very effective at resolving psychotic symptoms, but they're more likely to cause movement side effects like tremor, muscle stiffness, and involuntary movements. Second generation antipsychotics block less dopamine, like letting more people into the party, so they aren't as likely to cause the problems with movement. But they also target another neurotransmitter called serotonin that affects our mood, sleep, and appetite. This makes the second generation antipsychotics effective at treating not only psychosis, but also bipolar disorder and depression. But it increases the risk of metabolic side effects like weight gain and increased cholesterol and blood sugar. Some common side effects include dizziness, blurred vision, constipation, and feelings of restlessness. Not everyone gets these side effects, but if they do, they're often temporary and get better as your body gets used to the medication. Be sure to tell your psychiatric care provider about side effects so that you can work together to find the right medication for you. Antipsychotics can be taken as pills, dissolvable tablets, liquid, and long-acting injections. They can start helping within a week or two, but the full benefit can take up to 6 weeks. Antipsychotics treat symptoms, but they don't cure them, so it's important to keep taking the medication even when you feel better. Together, we can work to educate ourselves, our families, and our communities about mental illness and help those affected live long, satisfying, and productive lives.